Welcome back to HealthCare Consumerism Radio. This is Brent Macy and Doug Field, your host for today's show. And looking right at the healthcare transparency space. And, it's a very hot market. And joining us on the program for this segment is Bill Kampine. He's actually the co-founder of HealthCare Blue Book. Welcome to the program, Bill.
Thanks very much. Great to be here. Thanks for having me, gentlemen.
Hey, Bill. Great to have you on the program. And Ron says his hellos. He's playing in the beach down in Florida today.
Oh, that's great. Good for him. I suppose I trust that y'all survived the storm of the century last week.
Well, I was playing down in Florida last week, too. I had a business trip down there and then took my wife and oldest grandson down there. So I escaped it all. So Brent got stuck in it. So.
Good for you guys.
I let Ron and Brent suffer through that last week. Well, Bill, hey, great to talk with you. And, Brent and I were talking earlier on the opening news and views. I remember when we sit down with Jeff, your partner, quite a few years ago, you guys were first coming out with this, and you guys were way before your time, but you're right on mark, and now the market's surrounding you. So, congratulations on that. Update our market with, HealthCare Blue Book, where you are today, and what is your business model serving this market?
Sure, yeah, and great. Just for your listeners who may not be familiar with HealthCare Blue Book, as you had alluded to, and thank you very much for your kind comments, we're one of the first companies in the healthcare price transparency space. We were founded in 2007, although the fundamental work that was the research that ultimately would become Blue Book had started many years earlier. But we principally provide healthcare price transparency tools to self-insured employers, TPAs, regional health plans, and large provider organizations. And as you, again, had mentioned just a moment ago, obviously the general understanding of the issue of price transparency has grown tremendously over the past 3 or 4 years. I think it goes hand in hand with adoption of consumer benefit designs by some of our larger employers. And so with that, we've grown 2 or 3-fold and continue to serve our employer and payer community.
That's great. What as Ron talks about a lot, transparency is this big, broad, topic, and we talk together about the right to know, transparency. What transparency is really the right to know, the right of the consumers and other stakeholders to really know. What do you think is some of the most confusing aspects of transparency when you're that employer or that self-funded employer, you're that health plan, let's talk about this consumers later, but those first that are looking to adopt this tool, what are some of the most confusing aspects that need to help them, hurdles need to get them over?
Yeah, that is a great question. I'll delineate between confusion and understanding, just from the standpoint of HealthCare Blue Book, where we really begin with our clients is a very data-driven approach. And I think the most fundamental thing that you can do as an employer, or that we would do with our clients, for example, is to help them understand what is going on from a price perspective within the network that they currently have in the markets where their employees live and work every day. That is the fundamental understanding because, as I'm sure you're aware and has been pointed out in many different articles over the past year, markets are very, very different. It depends upon where you live in the U.S. and which network you're using. And really, if you, as an employer, in order to have a thoughtful transparency, an effective transparency program for your employees, you really want to understand where to focus your attention and what things do we want to focus on. And so really I think that big part is that upfront education to just help folks understand, okay, what is this? What is going on in my markets? Where are the big problems areas? And what are the things that I need to focus my attention on? And I think that's really important.
Now, Bill, this is Brent, when you look at your solution set and when you're working with the employers and the health plans and the channel partners that you mentioned, is there anything they're coming to you and saying, hey, Bill, is there a possibility that we can have this option built in to what you guys are doing, so therefore we can offer it as a solution across whether it's our employee customers or our health plan members?
Yeah, again, great question. And again, I think very important. So, again, from our perspective at Blue Book, I think we really look at it as an open architecture. Transparency and consumerism in particular doesn't exist in a silo. And so you want this information to be available to employees and members wherever they interact with both the healthcare system as well as the other support programs. Employers make huge investments in things like on-site clinics and wellness programs and other things to support their employees. And so as we look at it, we really focus on integrating with all of those different options, and we are very, very open to being thoughtful and creative about integrating these capabilities so that they are all part of a transparency solution, and that notion of consumerism doesn't sort of stand off to the side in a silo in order for it to be most effective. And, again, that could include integration of support programs, different quality initiatives. Some employers have high-performing network initiatives, and all of that Blue Book is designed to be very, very flexible to integrate and include all of that various information.
Very good. Bill, what's your kind of pricing business model for? Is it a per employee per month, per member per month kind of model? What do you?
Yeah, that's exactly right. So okay. We use a per employee per month fee. I think from that perspective, we are a very value-oriented organization. We want to make sure that this is a great investment for our clients, and our clients, typically get a positive ROI when only 1% to 2% of the population uses this to make better decisions about their health care.
Now, Bill, when you're looking at the per employee per month, when you're talking with your customers and your clients, how do you gauge success in your program for that client of yours?
Yeah, a wonderful question. So, at the end of the day, for a transparency program to be effective, we have to be moving cases from the higher end of the cost spectrum to the more value-oriented providers within that given network. And so really ultimately the test of effectiveness for us is are we tracking and how can we see that we are actually moving consumers to better value employers and how that actually translates directly into reduced savings. Of course, there are other aspects that are important that I think are table stakes for any group that interacts with consumers, obviously utilization and other metrics, but at the end of the day, it is, are we actually having impact on the choices that individuals are making, and is that manifesting itself as cost savings?
Now, to accomplish that goal, I mean, the word in the marketplace is engagement. How are you helping, your clients get that engagement with the consumers, the employees and the consumers?
Yeah, sure. So I think most folks in the transparency space, we do have that standard client toolkit that offers a fair amount of flexibility, and that's multimedia, videos, education. We like to do games and contests. This is something that has to be communicated regularly and constantly to keep people engaged because, someone may be informed or become first aware of price transparency tools as part of open enrollment, but, of course, they don't need care for 2 or 3 months later and aren't aware of it. So I think it's important to use those tools to keep it sort of front of mind. But, what is really, really effective for Blue Book are the use of tools that really, for us, help drive engagement, and that would include rewards. And when we talk about rewards, specifically it's not for utilization or registering the tool or looking at the tool. When we reward folks, we like to have the rewards tied to, did you use a high-value provider? And so for those who are familiar with Blue Book, we do a lot of intuitive color-coded guiding, better value providers we typically call green providers. And our program is Go Green to Get Green, and it has been very, very effective and very, very popular with users. In addition to that, there's very specific targeted messaging and outreach. We have a pre-care outreach program. There are certain things, obviously that we have identified up front that we want to focus our attention on, and we can reach out to members and help them make better decisions about guiding their care. In addition, and not all employers are ready for this step yet, but great use, great effectiveness of reference-based pricing in some instances, and we are doing that more and more with a greater number of our payer partners as the year goes by.
Well, when it comes to delivering consumerism tool, you actually have a pretty cool brand name too, Bill. Everyone's used the Kelley Blue Book at one point in time in their lives. I'm putting you in good company there. I know it's different, but very seriously, it's a cool brand name.
Right. Thank you.
No, but when we've actually got a group of physicians that are going to be doing a general session at IHC Foreman Expo here in Atlanta in May, and they're really going to talk about the ACA, but they're also going to talk about what's the relationship between them and their patients. And do you see, with the transparency piece, a more informed consumer coming in from a pricing standpoint, a quality standpoint? What's the role of really educating these providers and these physicians on, hey, you're going to have some patients coming in, they are going to ask you some questions you might not be ready for. What's the value to making sure that provider is educated in terms of cost?
Yeah, absolutely. So I think this is a really interesting phenomena that we've watched over the past few years. I don't know that a lot of other healthcare price transparency companies have sort of our perspective on this. Again, for your listeners, Blue Book also provides a free consumer version of our tool that allows people to go out and go online and look up what fair price is for a service in their zip code or their community. As part of that very public-facing free version of our software, we've done a fair amount of work with providers, and I think what we've noticed is, providers are changing as time goes by. Exactly what you had said. They see more and more patients with high deductibles coming in with concerns about cost, and in many instances, the providers, be they the primary care providers or perhaps specialists who, like an orthopedic surgeon who may schedule a surgery, are not aware of the cost differences between facilities that they may send the patient to for, say, a diagnostic test. And so this is changing very rapidly. I think it's an interesting area for Blue Book. It is an area that we serve. We do work with provider organizations to offer a version of our tool to help providers make better, more cost-effective referrals. I think it is of benefit to them not only for the patient as a consumer, but also under changing payment schemes where primary care practices or medical homes have more risk in terms of total cost for patients. It is indeed in their interest to help make more cost-effective referrals, and so they are using it for their own benefit as well. But it is a very interesting phenomena that we're seeing unfold.
And Bill, wouldn't you agree too that coming up over the next few years, accessibility and your tool can really help the consumers know what is accessible, correct?
Yes, no question. I suspect your question is referencing the narrowing of networks.
Yeah,
absolutely. Yeah, I think that'll be key as we see this unfold, I think, over the next couple of years.
Hey, Bill, we've got time flies when we're having fun, and really appreciate you being on the program. We've got about 30, 45 seconds to go. I want to give you a chance to leave our audience with some final words about HealthCare Blue Book.
Sure. Well, thanks very much again for the opportunity to chat with you all today. I think just as listeners consider price transparency and think about it for their organizations, a couple of things are critical. I think most importantly to understand up front what the landscape looks like and understand the problem rather than just assuming that transparency is a universal issue. It's going to be very different depending upon where your employees live and work. Focus on the items. Be practical. Focus on the items that really matter, and they'll move the cost needle both for the employees and the employer. I think simple, intuitive, direct interfaces are most effective. And lastly, don't be afraid to ask for flexibility and be creative and integrate transparency tools across all of the things that you do for your members. And with those items, you can have a very, very successful transparency program.
Hey, Bill, thank you so much for joining us on the program today. Have a great weekend. And to the rest of our audience, stay tuned for the next segment of HealthCare Consumerism Radio.